morning. I am Makeda London from Near North Health Service Corporation. And joining me is Dr. Bonnie Pete Thomas. We are here to highlight and to talk about Near North's annual Men's Health Week. You may not have heard about it, but you'll know a lot about it once this show is over. Dr. Thomas we are both co-chairpersons for our Men's Health Planning Committee. It's a lot of planning that goes into this. Wouldn't you say that, Dr. Thomas?
Absolutely. We have a lot of treats available for the men when they come out for that whole week.
Our annual Men's Health Week at all of our locations is June 10th through the 15th this year. We have various different interactive workshops, healthcare screenings, hypertension screening, blood pressure screening, colon cancer that Dr. Thomas can talk about, cholesterol screenings, diabetes, but the major focus is saving men's lives.
Absolutely.
Dr. Thomas is not going to do that all by himself. We have several different providers and services that will be going on that particular week. Dr. Thomas, would you talk a little bit about that?
So we're excited about this. As Ms. London was saying, we're really going to focus a lot of our efforts on men that week. And it's going to be all these various issues of chronic disease, cancer prevention, opioid epidemic, HIV screening. So it's going to be just a great experience where men can come out and get screened for these things without a major cost to them. They're going to be free, actually. A lot of these screenings will be free. There's going to be interactive workshops and food, of course, and haircuts, things that, of course, men, we like to go someplace where we can and get something to eat and learn something, and also maybe get your hair lined up or cut or whatever. But most important, you can come there, and if you have any questions or if you want to be seen by a provider, you will have that opportunity, and you can be screened for various things that we are at risk for, which is hypertension, diabetes, cancer, HIV, substance use disorders, mental health disorders. So we're really excited to focus on men for just that week.
Now, Dr. Thomas, there may be some women that are listening that want to know why are we focusing on men?
Yeah.
And are they able to come that week too?
Well, they absolutely are able to come that week. Our doors will be open to all of our patients, and even patients that are not ours. You can come in and be seen by one of our providers. And just to note that this is the National Men's Health Week, so we will be focusing a lot of our efforts on men for that week. But yes, if you are a wife or a mother or whoever, and you come with your son or your husband or your brother, you can certainly be seen during that week also.
Certainly, because our mission, we turn no one away, regardless of your ability to pay or your immigration status. That we're just highlighting
Yes.
men, because men don't necessarily embrace health care the way women do and don't regularly come to the doctor. But we do hope that they'll have a change of attitude, especially when they see you, Dr. Thomas.
Well, I think you're being generous, but I think that really Near North has just done this like nobody else has done. I mean, just 20 years worth of experience in putting together a dynamic program where men can come and learn in various workshops, but also get screened and also get fed and then also get the haircut at various sites throughout the city. I don't think that this is an opportunity that any men out there want to just let go by. And I mean, even if you have a provider, but maybe you have questions about something that you were told about your health. And men, we read various things in magazines and things about our health, and we want to know about our testosterone level and all these other things that come up. And this is an opportunity for you to come in and see a provider, get screened, get blood tests done, and get some good food and interact with some of the staff there. It's gonna be awesome. It's gonna be a really awesome event.
And we appreciate, Dr. Thomas, you and I, we do appreciate the fact that our CEO, Bernice Mills Thomas, decided that we would co-chair the planning of this event. It's a lot of planning that goes into it. We have individuals that do sponsor financially, sponsor. We have a lot of partners, people and organizations that will be doing interactive workshops. There will be tabling with information, and the fact that the men that see you and any other provider will be able to make follow-up appointments.
Yes.
All of this, and we're going to do it with a bang.
Yes.
We're going to start out with our kickoff ceremony on that Monday, June 10th. So everyone that look out for these flyers that will be distributed throughout the community that highlights all of our different health centers and the different activities that we're going to have. Our website, www.nearnorthhealth.org. You can contact us for any information that you want. Just make sure that you have this flyer, or if you desire to have it sent to your organization, it outlines all of the different activities that we're going to have. Our kickoff ceremony, I want to get back to that. What our CEO does, we call it a kickoff ceremony to kick off the events for the week. There is entertainment, there is guest speakers, there is refreshments, we have barbecue, we have food demonstrations, while all of the screenings and everything is going on. When you come in, it's like a party atmosphere.
Right.
Get excited about your health.
Right.
Is basically that we have the live remote, and we've had it in the past with WVON.
Correct.
And I understand that we're going to continue doing that. It is just an exciting time. I have men in my family, my husband and some other members of my family. They have attended for many, many years, even done workshops.
Yes, yes. I think it's going to be a paradigm shift, because I think many times men don't always feel welcomed in the health facilities, and it's always sort of a scary, unknown experience for us. And just to know that this event sort of makes that paradigm shift easier for us. So when you see all the balloons and the music and the refreshments, it sort of takes down the level of stress for our men, so that we can navigate a little bit easier and kind of make this as, hey, maybe I'll go over here and get screened for cholesterol and diabetes, and maybe go over here and get tested for HIV. Just a variety of things that will be available for our men. And I think the kickoff helps us, because it's such a festive kind of environment.
And it is, and you're absolutely right. The kickoff usually, if weather permits, and even one year when weather did not permit, is in the parking lot of CoMed Home and Health Center, 4259 South Berkeley. Across the street from the health center is where the kickoff is, under the tent. And the speakers are great. The individuals that will be speaking will be talking about health challenges that they've had that were overcome. And over the years, it has been very, very interesting and entertaining. And many of the men who come to kickoff and throughout the week end up also coming. We have a men's roundtable.
Yes.
Men's only roundtable.
Yes.
Why don't you tell us a little bit about that?
So this happens. This will happen at the end of the week at the Winfield Moody Health Center, which is on the north side. And this is a great environment, because the men can come in, and it's interesting because I always have something prepared to talk about, but what's nice is that the men sort of direct the conversation to what they think is important. And so it's always a very lively, dynamic discussion, and it is all encompassing. It talks about physical health, they talk about mental stress, they talk about their vulnerabilities, they talk about family stress, and oftentimes the men are also providing sort of therapeutic help to each other. So it's interesting, even though they might have myself in the room and one of our other mental health providers, but they are providing support for each other, and letting people know, and letting the guys know that, hey, at some point you're going to need to see someone for that. You're going to need to go in and sort of face your fears, if you will, and go get checked out. And so this is a great way to end the week, because they sort of leave with this sense of inspiration, this sense of empowerment, that this is not anything that's going to go away, and that if they care about their communities and their families, that means they have to come and see a provider and see what's going on and get themselves checked out.
And I want to emphasize, women, it is a men's only roundtable. And I heard, because I've never been invited in, I have never been present in the 20 plus years, but I've heard that in the past, even topics like the concealed carry.
Yes.
And the Chicago Police Department, someone there
Yes.
has actually come in and talked to the men at the round table. And even our chairperson,
Yes.
Judge Birch, has come in and he's talked. He had a workshop, Stay Out of Jail, or How to Stay Out of Jail, and interesting topics like that. And found out that many of the men really enjoyed that camaraderie among men at the men only roundtable. And no, women, we cannot come.
Yeah, it is a true no holds barred conversation, and like I'll bring up topics like African American men, for instance, have a 1 in 4 chance of dying from cancer. And we talk about the fact that, the 3 leading causes of death for cancer is prostate, lung, and colon. And, and the men can talk about their fears and about previous men in their families who have died prematurely from cancer and heart disease and HIV and drug abuse. And so the fact that we can come and share what we have individually experienced, and also people that we love and care about has experienced, then it helps us to know that we're not alone. We're not alone, and that there's a place where they can come to and get treated, and they would have had good food and good conversation and screenings, and they can get seen the very next week, right back at those same health centers where they went to. And so that's the beauty about the event, is that these are sites that are open for their business and for them to come back, and we welcome them to come back for further care if that's what they need.
And we certainly do. And for many of the men who have participated, we found that they did need to come back. Yes. And they became patients. And just like you said, Dr. Thomas, you don't have to be a patient of ours to come to Men's Health Week. And to help you remember, June 10th through the 15th, those who are listening, it is the week before Father's Day. Yes. Which is another great celebration that many men, women, and people across the world actually celebrate. Just as we have celebrated Mom's Day. Mm-hmm. We want you to remember June 10th through the 15th, 2019. And many of the men, when they come to the kickoff ceremony and come throughout the week, they return for lunch. Yes. Every day they return from for lunch. And we have male dietitians and nutritionists on the spot that do cooking demonstrations, and it's just an exciting time. And please tell everyone in your family that COMED, all roads lead to COMED Holman Health Center on June 10th for our kickoff ceremony. And then all of our other locations there on the south side. We also have our Cottage View location at 4829 South Cottage Grove, our Revis location at 834 East 50th Street, and our Winfield Moody location, 1276 North Clybourne, which is where the Roundtable is. Visit our website, as I've said again, and see all of the other locations. Our Sunnyside location, 4501 North Sheridan Road, North Costner, 1520 North Costner, Louise Landau, 800 North Kedzie, right around the corner from the Salvation Army that's there. Our Denny location, 30 West Chicago Avenue. All of our locations will be doing at that location. Our providers will be providing care at all of those locations for anyone that presents themselves. Don't worry about whether you have insurance or don't have insurance or you don't have the money, just come. That's what we want you to do. What do you think, Dr. Thomas?
Well, I think it's a great opportunity because in many cases, what we find is that it's easier to treat someone if we find out about their issue or disorder early in the process, in its beginning stages. If we wait, if we find out about it later, it oftentimes leaves us with less options. I'm not saying that we can't treat it, but it's just that we have less options when we are find out about the disorder later in its stages. So we're excited about an opportunity to get men in early, to get PSA levels done, cholesterol levels done, hemoglobin A1Cs, which is a diabetes marker. If we can get those levels done early, find out about what's going on, get you into care, get you on the correct regimen of medications or whatever. Maybe sometimes it's not medications, maybe it's lifestyle change, maybe it's eating a little less of stuff that we like to indulge in, and cakes and cookies and pies and things like that, and exercising. But even if we can just engage the men and get them into a more healthier conversation, a healthier behavior, and then if need be, medications, because oftentimes I know men aren't so excited about being on medications, but I try to explain better be on medications than to not have the option of being on medications and you die of a massive heart attack or stroke. And I'm not trying to scare anybody, but those are realities that we deal with on a daily basis. And so the idea is to get the men in, figure out what's going on early so we can intervene early.
So that you're talking about preventive care.
Absolutely.
Okay.
Absolutely. And prevention, they say ounce of prevention is better than a pound of cure. And I think what that, essentially means is that it takes a small amount of effort to intervene early when we can, lose a little weight, exercise a little bit, and bring down blood pressure and cholesterol and blood sugars. And then, but if we wait later, where heart disease sets up and stroke happens, and then we can't move parts of our body because of a massive stroke and things like that, then now that requires a lot of stress and pressure on the person, the family, and also our healthcare system in general as a nation. And so if we can begin to push people toward the earlier stages, which I think women do a great job of. We have great examples. Women typically will access the healthcare system much earlier than we do. And many times when we do access the healthcare system, it's done on an emergency basis. It's something that hurts to the point where we can't take it no more.
I like the way you said that, Dr. Thomas, on a emergency basis, that often men access it only on an emergency basis, where women, we've been brought up, many of us, that way to access more preventively. And we continue to do it throughout our lives, and not just that. And so you and other providers that the men will see will be able to encourage the men to do just that.
Absolutely.
And we hope that they'll come back after Men's Health Week and actually see you and the other providers on a regular basis. That's what our hope is.
And I also hope that if there's any female listeners out there that, if you have a brother or cousin or husband that is not so good about making appointments and keeping those appointments and haven't seen their provider, just bring them in for some food and refreshments, and who knows, get a little blood stick here or there, take his blood pressure. It'd be a great time to kind of check in. And even if the person is actively engaged, but you want to come out and to support men taking better care of themselves. And that's going to be a great event. And so if women can do that for their male loved ones, that would be great.
Certainly we can. Mm-hmm. Certainly we can, and we will. Dr. Thomas, would you say a little bit more about the HIV testing?
Yes. So two things. One is we have a comprehensive program called the Early Intervention Services at Near North Health Service Corporation, and we're excited about the opportunity to provide screenings for HIV. We have a rapid test if you are squeamish about getting your blood drawn. This is a finger prick, and you can find out what your results are in 20 minutes. And I think that's important because now there's a national push to end the epidemic by 2023. And so part of that means making sure that we know who is infected. Right now, the CDC states that there's a 1.1 million people in our country that are HIV positive and don't know it. So here's an opportunity for these men to come in, get tested with a finger prick, and know if they're HIV positive in the first 20 minutes. And so that's important for us, for those providers that take care of HIV positive patients, because one, we're really pushing, and not just Near North, but we are part of this push to end the HIV epidemic. And part of that is finding out who's positive, and the people that are positive, get them on medications as quickly as possible. But if you're negative, and if you feel that you're at risk, i.e. you're having unprotected sex, then we want to recommend that you be on PrEP. And PrEP is a medication called Truvada that helps HIV negative people stay negative. And part of what we're doing is presenting this as a prevention strategy. The prevention strategy is you want to remain HIV negative if you are negative. However, if you are having unprotected sex, that does put you at risk for HIV. And so the good thing is that during this week, we're going to have, and actually even beyond this week, we have availability for rapid testing plus serological testing, i.e. drawing your blood. So it'll be a great opportunity for you to come in. If you think you're at risk and you want to come in for HIV tests, we can certainly do that at all of our sites.
And all of these services are available during our annual Men's Health Week. Again, just the week before Father's Day. This would be a great gift that women could present to the men in their lives. And you can continue receiving these services after Men's Health Week at all of our health centers. And so we're looking for everyone who has heard, pass the word, email us for flyers, drop by our health centers. You can call. And also during that week, my major responsibilities is as a health insurance counselor. And anyone who doesn't have insurance, you can certainly stop by. Our health insurance counselors are available to you to assess what your options are. That's Medicaid, Marketplace, or Medicare. The 3 M's, we're there to help you all throughout the year, and certainly that particular week for health insurance. And then also at our CoMed site and our North Costner site, we have dental suites.
Yeah.
And we have a pharmacy on site at CoMed. So we're all things that relate to your health coverage in one location. Once you become a patient, you are able to access those services.
Then I also want to mention Ms. London, that we're going to have a fraternity challenge. And
yes.
So we're asking that all of the the African American Greek letter organizations to come out and support, especially the fraternities, in particular Alpha Phi Alpha Fraternity Incorporated, Kappa Alpha Psi, Omega Psi Phi, Phi Beta Sigma, Iota. We want all of these organizations to come out and to support men taking better care of ourselves. A lot of our founders and organizations were founded on us taking care of our communities, but it's going to be more difficult for us to take care of our communities if we ourselves aren't healthy. And so we're asking that all of these chapters and organizations come out to support. Wear your letters. We're hoping to see a lot of the men of Black and Gold, Alpha Phi Alpha, come out. Of course, that's my organization, but we're looking for everybody: the Omegas, the Kappas, Sigmas, Iotas.
What about the purple ones?
Well, we want them also. We want them also, and we know they. So we want those men to come out, and each day, every organization will have their own particular day to come out and sort of help support, but also to go and get screened, and it'll be their day to promote their organization being a part of National Men's Health Week at the Near North Health Service Corporation. So we're excited about getting all the fraternities out, and to, of course, wear your colors, wear your fraternity sweaters and hats and everything. So we're excited about having all the guys come out.
And that's exciting for this year. I remember previous years the fraternities did participate,
Yes.
and they did workshops, and they came out. A lot of them came out and supported us and even sponsored.
Yes.
So it sounds really exciting. So we don't want people to forget what we're doing and who is doing it. This is our annual Men's Health Week, Near North Health Service Corporation. Our kickoff at our CoMed location, 4259 South Berkeley, and that's June 10th through the 15th, 2019. We're looking forward to seeing you there.